Dire reports this week from hospital and insurer groups on a Republican plan to delay replacing Obamacare. But, Steve, you say the remedy is just to get rid of all the middlemen, insurers, and the government, and make the patient the customer again. Explain.
Sure, David. Whenever we have real free markets, scarcity is always turned into abundance. Prices always come down. Why not with health care? You see it with LASIK surgery for the eyes, where the customer, you don't have that disconnect between doctors and patients. You see it in cosmetic surgery. So how about having hospitals post prices for all their products and services? How about hospitals posting each month how many patients die from infections received after they're admitted to the hospital? 90,000 a year. David, there's a surgery center in Oklahoma called the Surgery Center of Oklahoma, and their prices are low. They bundle. They're public about it. They don't take insurance. They're so good that now the state of Oklahoma's having its own employees go to them because they're so cheap and effective.
Bruce, really the point is that you put as little distance between the patient and the provider as possible, but now we have all the middlemen. And by the way, life expectancy for the first time in a long time is going down in the U.S. All kinds of increases from various diseases. As Steve mentioned, some of the hospitals are getting dirty. Don't we just want to shrink the middlemen, get the middlemen out of the business?
Well, I would be for, which would never happen, the Bernie Sanders idea of single payer, which would get rid of all the middlemen known as insurance companies. But that's not going to happen.
Put a big middleman in the middle known as the government. I mean, that's the middleman there. Go ahead.
Well, no, but I would say that one of the things that Obamacare, and even the president didn't talk enough about this, does is it moves the system away from fee-for-service medicine to value-based care, which does put the patient at the center, where you're not just treating people once they get into the hospital. We heard at the Forbes Healthcare Summit last week where Humana has 10,000 nurses, where you're moving the providers more out into the community to get people and stay well before they get sick and in the hospital, which is a worry of the hospital industry.
It is a worry. But, Mike, the point is that health care is a service. The Obamacare wanted to make it something else, some government right or something. But it's a service like all other services. And if the customer has more choices, the customer's better off.
Yeah, to me, David, there's no mystery with health care. There's nothing that distinguishes it from, say, food or sneakers or anything else that you buy. It should be a decision based on the customer. And, you know, it's extremely personal. You know, what doctor I want to see, what type of treatment I want. It's much more personal than anything else. So the more control I have, the more I'm going to feel comfortable with it.
But, Rich, let's talk about this very interesting kind of coalition between establishment types inside the Beltway, including Republicans, working with insurers and hospitals, coming out with a study saying it's going to cost $165 billion if we get rid of Obamacare too soon. Frankly, this is ridiculous to me. I mean, the sooner the better, I think, if something's not working.
Well, I think you have to disrupt the existing order, and particularly, you know, when many of these hospitals are not behaving professionally, as Steve points out, and are not being transparent about prices and about infection rates. But I have some sympathy for them, because if you take away Obamacare, you're simply going to get people crowding emergency rooms, and the hospitals are left dealing with this.
Yeah. But, John, the point is that Obamacare has been taking us in exactly the wrong direction. If you want to get out the middlemen between the customer, the patient, and the provider, that means that you give the customer more say over his own money. That's what flexible spending was all about, when, in fact, Obamacare cut flexible spending from $5,000 down to $2,500.
Absolutely. When free people are venture buyers, high prices fall. The first ballpoint pen cost $15. Now it doesn't. The first laser printer costs $17,000. My problem with the Republicans is stop coming up with solutions and just repeal Obamacare. Once you do that and just allow competition into what is a service like any other, you will see prices fall, because those who provide the service will come in and compete on price.
And you'll also see less abuse and fraud, because when people are in charge of their own money, Sabrina, they're much more careful about how it's spent. By the way, Medicare, just one major government healthcare enterprise alone, weighs $60 billion a year because the individual doesn't have control over it.
Right. I mean, I think that the central goal in all of this is to give individuals more ownership and control over their health care dollars. To Mike's point, the way we have control over our food dollars and our clothing dollars, to sort of respond to some of the progressive concerns. I think one of the reasons there was this big push for universal coverage was because they felt that people weren't going to a doctor soon enough. But if we repeal Obamacare, it means that insurance would go back to being what insurance was originally intended for catastrophic things, not for your daily or routine visit to the doctor. So we're all going to have to sort of reset the way we think about insurance, and this will be much better for everyone.